Do you see a lot of fellows that go right from fellowship into starting a private practice, or do a lot try to work for the hospital system or private practice for a couple years and then go off and start their own?
Well, I can tell you this. The ones that I see, I mean, we get an awful lot of residents and fellows that are starting up their own private practice. But there are many more out there that are employed that, I get so many new clients on an annual basis that are doing startups. And as I said, I'm seeing about 75% coming out of school to do an independent practice and about 25% coming out of employment. I've seen that percentage rise over the last year or two, meaning that more and more employed physicians are coming out and starting to go back into private practice. So at least for me, I'm seeing more that are coming out of school and starting at private practice, but the percentage of those coming out of employment is increasing each year, especially when you start getting to the point where a physician's contract is coming to term. Right. And a lot of times either the hospital will release them, especially if they aren't meeting the RVU requirements that they have in their compensation package. So the hospitals will release them, and then the doctors are trying to figure out what they're going to do. Some of them have signed non-competes, which is really a bad situation for the physician. Yeah. But in almost all cases, there are ways to get your practice set up, but you really have to make sure that you don't have a non-compete because you don't want to be sued. And, those hospitals have a lot more resources than the independent physician does to fight that kind of thing.